Have you ever wondered why a physician takes your blood pressure? Blood pressure is the force in which the blood is pumped against the walls of the artery. The systolic blood pressure is measured when the left ventricle of the heart contracts. This systolic blood pressure is measured when the heart relaxes. Blood pressure helps the doctor know if a patient is at risk for a health problem. A high blood pressure, also known as hypertension, is a major cause of stroke and heart attack. A low blood pressure, hypotension, is usually not a major health problem. When taking a blood pressure, it's very important to take it and chart it right. If you take a blood pressure wrong or chart it wrong, then the doctor may think that something is wrong with the patient when it's not, or the patient is doing just fine when they're really not. And make sure you always use a black pen to write in the chart. When taking a blood pressure, there's a few things that you will need. Your sphygmometer, also known as your blood pressure cup, your stethoscope, alcohol wipes, and a black pen. Now let me tell you a few things about these. The sphygmometer, like I said before, is also known as your blood pressure cup. It's used to measure the blood pressure. The stethoscope helps magnify body sounds that you'll be able to hear the lub-dub sound that you should hear for blood pressure. There's two types of machines that you can take blood pressure with. The mercury, which is handheld, which is one just like this, or the aneroid, which is a machine that takes it for you. It's an electronic machine. Now, after you've gotten all your equipment ready, then you need to go get the patient. First, identify the patient and introduce yourself. Make sure that you get the patient's full name and their birthday because you want to make sure that you get the right patient. And also tell the patient your name and what your title is. And while you're taking them to a quiet place to do this, explain to them what you'll be doing. After you get into the room, you wash your hands and tell the patients what you will be doing to them. And always make sure that the patient understands what you will be doing. Have the patient sit in the chair in the examination room and roll up their sleeve if needed. If the sleeve cannot be rolled up, or it's tight when it's rolled up, then have them change it to a gown. You never want to take a blood pressure over clothes because it can give you a wrong reading. And you always want the patient sitting unless the doctor tells you to take it otherwise. Make sure the patient is comfortable before you start. Now it's time to start trying to get the blood pressure. Have the patient rest their arm on a flat surface so the elbow is right above the heart. Make sure you have the right cuff for the size for the patient. If you're not sure of the cup size, always use the bigger one. Find a bronchial artery in the arm, which is about here. Place a cuff around the arm so the midline of the bladder is right above the pulse. Make sure it's tight around the patient's bare upper arm, but the bottom of the cuff should be 1 inch right up to the scales. This is where you will place the stethoscope. Make sure that the micrometer is centered so that the mercury column is at eye level and it's easy for you to read. And make sure the tubing of the blood pressure cup is not wrapped around or tucked inside the cup. Close the valves tightly of the bulb, which is this part of your blood pressure cup, tightly. Start inflating the cuff rapidly at 70 millimeters with one hand, then keep inflating by 10 while you take your other hand and feel for the autorator pulse. Take note of the pressure when you feel the pulse disappear and suddenly reappear. Open the valve so the pressure is released. Make sure the cuff deflates totally. If you do not deflate the cup totally or wait 30 seconds, then you can get a wrong high reading. Take the stethoscope and place the earpieces securely and comfortably in your ears. Make sure that you point upwards and towards their nose. Make sure that the stethoscope is turned on the diaphragmatic pressure. Check this by listening as you tap on the stethoscope head lightly. Now place the head of the stethoscope over the bronchial artery right below the lower part where the cuff should be. Make sure that you hold the stethoscope tightly with your index and middle finger. Do not hold it with your thumb because there is a pulse in your thumb that can interfere with the reading. Make sure that the head of the stethoscope is in contact with the skin all the way around the boundary. Now start to inflate the bladder quickly and steadily to a pressure of 30 to 40 millimeters above the normal previous determined by the palpitation. Then unscrew the valve a little and deflate the bladder of the blood pressure at 2 millimeters per second while you're listening for the lub-dub sound. As the pressure in the bladder falls, Note the numbers on the meter when you start hearing the respective sounds. This is systolic pressure. This will be your first number that you get. Continue to deflate the flow slowly, listening for the point when the sounds change from a strong sound to a muffled one. This is your second number. Keep deflating the cup. Keep note when the sound disappears. This is the systolic pressure. Deflate the cup the rest of the way and remove it from the patient's arm. Now you need to get the chart. You take the chart and record all three numbers separated by dashes. This is an example of how you would write it. Remember to put the date, the time, the arm used, the position of the patient, and what cuff was used if other than the average adult cuff was used. Fold the cuff and put it away. Tell the patient you have finished and let them know what will be coming up next if they're going to see the doctor, or tell them they may leave if that's all they're there for. You disinfect your earpieces and diaphragm with the alcohol wipes and you throw them away, and then you wash your hands. In conclusion, you need to make sure that you know that it is very important for the patient and the doctor that you get the blood pressure right. If you're not sure about it, retake it. It's nothing wrong with that. If you take the blood pressure like I showed you today, you will always have a good chance of getting it right the first time.